Hi viewers, this is Dr. Iftikhar from Pakistan. Today I'm going to present a lecture on equine viral arteritis, which is also known as equine typhoid, episodic cellulitis pink eye, episodic lymphangitis pink eye, and Rotloff. In today's lecture, we'll cover the information regarding the organism that causes equine viral arthritis and its epidemiology. We'll also talk about the history of the disease, how it is transmitted, species it affects, and clinical and necropsy signs observed. Finally, we'll address the prevention and control measures as well as the action to take if equine viral arthritis is suspected. Equine viral arteritis is caused by equine arteritis virus, an RNA virus in the genus Arterivirus, family Arteriviridae, and order Nidovirales. Isolates vary in the virulence and the potential to induce abortions. Only one serotype have been recognized. Limited genetic analysis suggests that this virus strains found among the donkeys in South Africa may differ significantly from isolates in North America and Europe. The first virologically confirmed outbreak of this virus in the world occurred on a standardbred breeding farm near Bucyrus, Ohio in 1953. The little concern was expressed at that time. However, the disease was again thrust into the limelight following a 1984 epidemic on a large number of thoroughbred breeding farms in Kentucky. The periodic outbreaks still occur. The antibodies to this virus have been found in most countries where the testing have been done. Seropositive horses have been reported in North and South America, Europe, Asia, Africa, and Australia. Infections are common among the horses in continental Europe but rare in the United Kingdom. This virus appears to be absent from Iceland and Japan. The prevalence of the equine arthritis virus varies significantly among the horse breeds. In the United States of America, this infection is particularly common among the standard breds. In a survey done in 1998, 24% of unvaccinated standard breds and 4.5% of thoroughbreds, 0.6% of quarter horses, and 3.6% of warm blooded horses have had antibodies to this virus. Overall, approximately 10 to 70% of the infected stallions become carriers of this virus. The equine arthritis virus can be transmitted on fomites, including equipment, and may be spread mechanically by humans and animals. This virus is inactivated in 20 to 30 minutes at 56 to 58 degrees Celsius, but can remain viable for 2 to 3 days at 37 to 38 degrees Celsius and for up to 75 days at 4 to 8 degrees Celsius. Semen remains infectious after freezing. The equine arthritis virus is found in equidae. Antibodies to this virus have been reported in horses, ponies, donkeys, and zebras. Illness occurs mainly among the horses and ponies, but clinical signs have also been reported in experimentally infected donkeys. This virus might also be able to cause disease in South American camelids. The incubation period varies from 2 days to 2 weeks. Infections transmitted venereally tend to become apparent in approximately 1 week. Most equine arthritis virus infections, especially those that occur in mares bred to long-term carriers are asymptomatic. In adult horses, the clinical signs may include fever, depression, anorexia, limb edema, particularly in the hind limbs, and dependent edema of the prepuce, scrotum, mammary gland, or ventral body wall, conjunctivitis, photophobia, periorbital or supraorbital edema, and rhinitis can also be seen. Some horses develop urticaria, and the hives may be localized to the head or neck, but are sometimes generalized. The abortions or stillbirths can occur in mares that are pregnant when they are exposed. Abortions are not only necessarily preceded by the systemic signs. Temporary decrease in fertility, including reduced quality sperm and decreased libido, may be seen in stallions during the acute stage of the disease. The decrease in sperm quality has been attributed to the increased scrotal temperature and edema, and can persist for up to 4 months. The quality of the semen is not decreased in carrier stallions, except in the cases of severe disease in foals. Deaths are rare. In recently infected animals, equine arthritis virus may be recovered from the nasal secretions, blood, and semen, as well as from a number of tissues and fluids at necropsy. Carrier stallions can be identified by isolating the virus from the semen. Equine arthritis virus is not found in the respiratory secretions, blood, urine of the carriers. Immunohistochemistry can identify viral antigens or in the necropsy samples, as well as in the skin biopsies from acutely infected horses. The latter technique is not completely reliable. Histopathology is helpful in clinical cases. Venereal transmission can be controlled by good management and vaccinations. To protect the pregnant mares from abortions, they should be separated from the other horses and maintained in small groups according to their predicted falling dates. Newly acquired horses should be isolated for 3 to 4 weeks. The vaccinations appear to prevent the unaffected stallions from becoming long term carriers. Well, this is the end of our today's lecture. Thank you so much.